Feel like a change, or do you like things the way they are? Either answer is acceptable when it comes time for Medicare Open Enrollment, but both require some review. Abby O'Brien is here to review for us the options that are available and why they need our attention right now. Abby is the Director of Broker Sales, Individual and Government Programs for Medical Mutual of Ohio. Welcome back to the show.
Great to be here, Lori.
So why is Medicare Open Enrollment so important?
Well, it's so important because this is the one opportunity that you have throughout the year to make that change. So evaluate your plan. Is it working for you? Look at other options. Do you like the way your prescriptions are covered? Are your doctors in the network? And the important thing to remember is you only have until December 7th to make that change, and it will start January 1st. So still a little bit of time, but it's important to
now.
Yeah, exactly.
What's the difference between Medicare and Medicare Advantage?
So Original Medicare is the federal government's program. It's parts A and B. Part A being your hospital coverage, Part B being your doctor coverage. Medicare Advantage is administered by private insurance companies, and there are some key differences between the two. So if you have Original Medicare, you have a co-insurance and there's no out-of-pocket maximum. Medicare Advantage plans have a specific out-of-pocket max, so you know the most you'll pay every year. Original Medicare doesn't cover prescriptions. Most Medicare Advantage plans do have prescription benefits built in. Another thing you want to consider is that Original Medicare does give you the flexibility to go see any doctor that accepts Original Medicare, whereas a Medicare Advantage plan is going to have a doctor network. So it's really important that
you're kind of stuck to that list.
Exactly, exactly. And the last thing I'll point out is Medicare Advantage plans add some extra benefits like dental and vision, silver sneakers, which is a no-cost gym membership for customers. So there are some extra things in a Medicare Advantage plan that you wouldn't see in Original Medicare.
Some things to think about there.
Yeah.
Can you tell us what to look for in a Medicare Advantage plan so we know it's the right one for us?
Definitely. So you want to look at premiums first of all. It's important that you're going to pick a plan that has a premium that really fits into your budget. And then you want to look at coverage. So am I comfortable with the out-of-pocket maximum on that particular plan? And then, of course, you want to look at doctors, right? I mentioned that before. Are the doctors that I need in that network? And then don't forget about the prescriptions as well. Am I comfortable with the way that plan will cover my prescriptions?
Okay. And Medical Mutual has HMO plans and PPO plans. What's the difference?
We do. So the difference is the way the network works and then also the cost. So on an HMO plan, a health maintenance organization, you have to stay within that network unless it's an emergency or it's urgent care. And for that, you're going to pay a lower premium usually. On a PPO plan, you have that flexibility to get services outside of the network. You're going to pay a little bit more. But again, with that, your premium is likely to be higher.
Okay. So there's a lot to think about. So where can we go if we have more questions?
Great place to start is the federal government's website, which is medicare.gov. They have a very helpful tool called Medicare Plan Finder. You can put in the prescriptions you're taking, the pharmacies that are important to you, and it will evaluate the best plan for you. We also have the ability right on our website, at Medical Mutual's website, to enroll and evaluate our plans. And if you want to talk to somebody, call our 800 number, and we have licensed agents that are able to talk you through those plans, even get you in touch with somebody that would meet with you face-to-face as well. And then don't forget about asking your local insurance agent that may represent our plans.
All right. Sounds like there's places to go for help.
That's right.
So if you have a current Medicare plan, the question now is, should you stay or should you go? You have time to research and review before you're rendering your answer, but don't wait too long. Medicare Open Enrollment ends December 7th. My thanks to Abby O'Brien for making us aware of our options today.
Find out more about Medical Mutual of Ohio by visiting www.medmutual.com/go or call 1-844-606-5387. Up next,